myths about diseases. We have a few special guests and some concerned citizens to help discuss this topic. Let's give them a warm welcome. All right, why don't you guys introduce yourselves and tell us a little bit about why you're here?
Hi, I'm Dr. Susan Price. I'm a general family physician, so I know a lot about viruses and vaccines. Thank you so much for having me today.
Hello, America. My name is Dan Thiemann, and I'm from Pawnee, Indiana. I'm here to have my questions answered about Ebola.
Well, thank you. Shall we get started? Dan, ask away.
Thanks. Well, ever since last year's Ebola outbreak, I have been very concerned about its infectiousness. Is it true that you can contract the disease just by looking at a person with Ebola?
That is so not true. The only way it can be spread is from direct contact with the patient's blood or secretions. For example, through broken skin in the eyes, nose, or mouth. During an outbreak, those at highest risk of infection are health workers, family members, or others in close contact with the infected people, and mourners who have direct contact with the bodies as a part of burial ceremonies.
Oh, good thing I avoid funerals. All right, next question.
Well, doesn't bringing Ebola patients to America put other Americans at risk? Should we all go into our bunkers now?
There is a big difference in bringing a patient with a known case of Ebola to America versus bringing a patient with an undiagnosed case of Ebola to America. The facilities that the United States have the best containment equipment available. They also are looked after by highly specialized and trained doctors, so the inherent risk to the general public is extremely low. The highest risk of infection is actually to the healthcare workers themselves.
But after Ebola is cured, you can still pass it on to others, right? These people should be deported.
Much like any other disease, once it has been cleared from your body, there is no more of the functional virus. That is the job of your immune system, to recognize an invading pathogen and clear that pathogen from your system. Ebola is an acute infection in humans and doesn't have a latent part of its infection cycle, like with HIV, which can hide in certain cells and be dormant.
Well, that doesn't make any sense. That's not what Real Scientist 419 on Yahoo Answers told me. Are you telling me I built my bunker for nothing?
Unfortunately, yes.
Well, thank you for that truly enlightening information, Doctor. Looks like those myths have been debunked. After a quick word from our sponsors, we'll be back to talk about vaccines. Welcome our next guest, Rainbow Waterfall.
Hello everyone, my name is Rainbow Waterfall. I'm a concerned mother of 3, here to discuss the link between hearing loss and vaccines. I'm on the fence about vaccinating my kids. I mean, why are vaccines important? People rarely even get the diseases they protect against anymore. And my child doesn't deserve to have a needle poked in him. Let everyone else get the vaccines, then my child will be safe.
That is the goal of vaccines. It means they're doing their job. Like some diseases today, like polio and diphtheria, are becoming very rare in the US. Of course, they're becoming rare largely because we have been vaccinating against them. Vaccines are necessary to keep what is called herd immunity. Herd immunity is when a high enough number of people in a population are vaccinated against a specific disease, and it is unable to keep a foothold in the community. This is the goal of vaccines, and without careful upkeep, our herd immunity could fail to keep our population healthy.
But I've heard from other mothers that vaccines can be very unsafe for my children. They even cause autism.
This is completely false. A recent study done by the CDC showed that there was no link between autism and vaccines. The only bad side effects of vaccines are itchiness at the site of injection and some bruising or soreness. Vaccines are really only dangerous if you are allergic to any of the contents. Then there can be serious complications. These allergies are very rare and are usually known before immunization.
Well, vaccines do contain dangerous mercury. Why should I risk exposing my child to that? They could turn into the Mad Hatter.
Oh boy. Vaccines contain thiomersal, an organic mercury-containing compound added to some vaccines only as a preservative. It is most widely used preservative for vaccines that are provided in multi-dose vials. There is no evidence to suggest that the amount of thiomersal used in vaccines poses a health risk.
But my kids already had the chicken pox, so they're like immune to everything now, right?
Well, first off, chickenpox is only related to shingles, not every other disease, ever. Second, it is still possible to get shingles as a result of having had chickenpox. However, the virus that causes shingles, the varicella zoster virus, can be spread from a person with active shingles to another person who has never had the chickenpox. In such cases, the person exposed to the virus might develop chickenpox. In this case, your children could infect other healthy children with this virus.
Well, my book club will be very excited to hear about this. Thanks, Doctor.
Thank you, Doctor. We'll be back after this commercial break.
Oh hey, didn't see you there. I was just looking through my Leica BF200. It's really hard to look at cells, but it's not so hard when you're looking under the Leica. The Leica Boyfriend 200. And as Charles Darwin once said, science is cool.
Now let's welcome our new guests. Why don't you two introduce yourselves?
Hello everyone. I am Dr. Paul Jeffro. I have a doctorate from Harvard and I specialize in HIV and AIDS.
Welcome to the people like me. I'm Jane Smith and I'm hoping to discuss some of the things I've heard about HIV from my witch doctor to see if they're true. Can you really get HIV from mosquitoes?
Actually, studies about HIV clearly show that the virus responsible for the AIDS infection is regarded as food for the mosquito and digested along with the blood meal. As a result, mosquitoes that ingest HIV-infected blood digest the blood within 1 to 2 days and completely destroy any virus particles that could potentially produce a new infection. Since the virus does not survive to reproduce, HIV cannot get passed on. Many people think of mosquitoes as tiny flying hypodermic syringes, which is completely false.
Is HIV the same thing as AIDS? If so, why are they spelled differently?
HIV stands for Human Immunodeficiency Virus. Over time, your immune system can clear most viruses out of your body. However, with HIV, the human immune system can't seem to get rid of it. That means that once you have HIV, you live with it for life. HIV can destroy so many of your CD4 cells that your body can't fight infections and diseases anymore. When this happens, HIV infection can lead to AIDS, which stands for Acquired Immune Deficiency Syndrome, the final stage of HIV infection. Also, not everyone who has HIV progresses to AIDS.
Ah, well, those are all my questions. Thanks for answering them.
One more time, ladies and gentlemen, those myths have been debunked. Thanks to our special guests. Okay, that's our show for today, ladies and gentlemen. Thank you for being here for another episode of Debunked. Join us next week to find out which of these pets is a household hazard.